Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I will begin today's update with a review of our recent positive cases. The number of positive COVID-19 tests in Dare County is 97, 36 of which are considered active and in home isolation. Of the 97 cases, 59 are residents and 38 are non-residents. Since the last Dare County Department of Health and Human Services update, issued Friday, June 26, there have been 20 new positive cases. Of these 20 cases, 18 are residents and 2 are non-residents. The Dare County website has already been updated to reflect all of these cases. Of the 18 resident cases, 12 of the cases are connected. The 12 individuals are close acquaintances or family members and acquired the virus through direct contact. 4 are symptomatic and 8 are asymptomatic. 3 of the cases are family members, all symptomatic, who acquired the virus from another family member whose positive result was reported on 6/24. 1 is asymptomatic and acquired the virus by direct contact with an individual whose positive result was reported on 6/24. 2 other cases are not connected. 1 is asymptomatic and 1 is symptomatic, and both most likely acquired the virus by community spread. Of the 2 non-resident cases, the cases are not connected. 1 is asymptomatic and acquired the virus by direct contact outside of Dare County. 1 is symptomatic and most likely acquired the virus through community spread outside of Dare County. Contact tracing has been completed, and direct contacts provided by these 18 individuals have been identified, notified, and directed to quarantine for 14 days from the last date of exposure with the positive case. Calls are made to check on compliance with the quarantine directive, and legal action can be taken for individuals violating quarantine and isolation orders. Quarantine separates and restricts the movement of people who were exposed to a contagious disease to see if they become sick. Isolation separates sick people with a contagious disease from people who are not sick. Isolation and quarantine are public health tools to help protect the public by preventing exposure to people who have or may have a contagious disease. Today we are partnering with Mako Medical Laboratories to host a community testing event. Today's clinic is full, with 525 appointments reserved. Details on the results of this testing event for the antibody test and diagnostic test will be shared in next Tuesday's update. Area healthcare providers are experiencing a delay in receiving results from the commercial laboratories. The turnaround time to receive results is now taking an average of 4 days. This delay is being experienced across the region due to the increase in testing. The lab companies have communicated that they are working to improve the turnaround time and hope to get back to the 48-hour to 72-hour turnaround time soon. Dare County Department of Health and Human Services monitors and evaluates 4 key metrics associated with disease investigation and surveillance. The metrics are number of tests, confirmed cases, positive test as a % of total test, and COVID-like illness surveillance. This past week, we had the highest number of COVID-19 diagnostic tests performed by healthcare providers in Dare County at 578 tests. This brings the total number of tests performed since early March to 2,569. We had 44 positive cases between June 22nd and June 28th. The % of positive tests to overall tests in Dare County since we started testing in early March increased slightly this week to 3.62%. The % positive to total tests for the past week alone was 7.6%. The syndromic surveillance of individuals who presented to the emergency department with COVID-19-like symptoms increased this week. We are also seeing an increase in the number of sick individuals presenting to the area urgent care centers. These graphs can be found on the Dare County website at darenc.com/COVID-19. Please do your part to slow the spread of the virus by following the 3 W's: wear, wait, and wash. Wear a cloth face covering if you will be with other people. Wait 6 feet apart and avoid close contact, and wash your hands often with soap and water for at least 20 seconds or use hand sanitizer. While there is now a mandate in North Carolina where individuals must wear a face covering when social distancing cannot be maintained, there are individuals who have legitimate medical reasons and are not able to wear a face covering. We all need to be kind, show compassion and understanding. We encourage you to stay informed by visiting darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 Call Center, open Monday through Friday from 8:30 a.m. to 5 p.m. at 252-475-5008. Thank you.